Fireside Chat session lined up for you on microbes, medicine and the future, battling AMR, disease X and emerging threats. It's a very specialized discussion and it promises to be incredibly interesting, so listen up. And to moderate the discussion and navigate us and spearhead the conversation, if I can please call upon stage Kalpana Sharma. She's the editor of Health and Lifestyle with the Times Network. And joining her, Dr. Kamini Walia, senior scientist with ICMR. So with that, ladies and gentlemen, we promise you a power-packed fireside chat. A lot of your most burning queries will perhaps get addressed and answered. And with that, ladies, I'll leave it over to you. Kalpana, the floor is yours.
Thank you. So good evening all of you, and I hope you all are having a good time. So after all these engaging conversations, we are moving on to a slightly serious but very, very important topic, something that we all should be talking about. And for the past 1 hour, I'm talking to Dr. Kamini Walia, who's a senior scientist with ICMR, has a very, very important role to play. And today we are going to discuss about our COVID post-pandemic preparedness, disease X that we so keep hearing about, and much more. So welcome to our ET Awards, ma'am. And I would like to start with, since AMR is a subject that you talk about a lot, you're spreading awareness, you were in Seoul recently working on that. So let's begin right away with that itself. It is being called a silent pandemic, yet we don't hear such open discussions on it. So what's your take? What do you want to say?
Thank you, Kalpana. And at the outset, I would like to thank the organizers for giving space to antimicrobial resistance and also the related health topics which you plan to cover in this side chat, because it is a very important area for us. It was always very important. I have been working in this space since 1999, and but unfortunately, at that time, a lot of countries' resources and attention was towards containment of HIV/AIDS. As you would recall, we were going through a very bad time as far as HIV infections were concerned. And then there was this report which was published in 2010 and 11, which kind of claimed that India is the hotspot of drug-resistant infections. And I think that was too harsh for the country to take, because antimicrobial resistance is an important area, but it exists in every country, it exists in every healthcare system. So in that way, India is not very different, but the fallout of that particular report was that India put together a national program on AMR. So now I think we have made a lot of progress. For the audience who are not aware about antimicrobial resistance, I would just like to give a brief introduction to it, that we used to use a different set of antibiotics 10 years back, 20 years back. You would recall taking Septran for a sore throat. But now that medicine has disappeared, and even your sore throat doesn't get cured with that medicine, because the bugs that cause your sore throat or the other infections, they become resistant to the antimicrobials which we use routinely. For example, everyone is popping norfloxacin these days for any loose motions or any loose stools. And now the situation is that the norfloxacin also has become ineffective in treating diarrheal infections. So that's why we should be using antimicrobials with caution, whether they are antifungals or antibacterial medicines, because emergence of antimicrobial resistance is a direct consequence of overuse of antimicrobials. So whenever we pop a drug, especially antibacterial drugs, which are antibiotics, we should be very cautious about it. And one thing we should remember, that antimicrobials are not active against viruses. And that is exactly what happened during COVID time. because we did not have any specific treatment for COVID, everyone was popping azithromycin, Monosef. So many brands were, drugs were misused. So that's why post-COVID, actually, there has been a lot of focus, and very rightly so. The reason we call it silent pandemic is because if you have a case of polio or tuberculosis or your COVID for that matter, system is notified. Right. But how many drug-resistant infections are notified? Not even one. So there are people who are dying from sepsis because of drug-resistant infections that are acquired in the hospital, but they are not notified. We still do not, in spite of working in AMR space for last 10 years, we still do not have a disease burden estimate for the entire country for AMR, and that is precisely the reason why it is silent. Apologies for a long answer.
No, something that we all should know about. And every time we walk up to a chemist with a flu infection, with the flu, and ask for an antibiotic, I think that needs to stop. Thankfully, a lot of they have been asking doctor prescription, but we still know it's easy to get antibiotics in India. So that takes me to my next question, and please correct me if I'm wrong. The last antibiotic was discovered in the 1980s, and we have not had any antibiotic post that. And with the AMR on rise, how are we, how do you see the situation? What are we doing about it?
So regarding discovering new product, there's a lot of investment in terms of time, and millions of dollars actually go, or billions of dollars actually go into discovering a new drug. Yet, I think we have introduced few drugs in last few years. There are few companies in India who have come up with new products. They are not just selling it in India, they are selling it globally. They are doing global trials. And also recently, Department of Biotechnology, in collaboration with one of the pharma companies in India, they launched a new drug by name of nephithromycin, which will be useful for lung infections. So it is not that we are not discovering new antibiotics, but yes, the golden age of antibiotics, which we saw in 60s or 70s, when a lot more products were being discovered, it is slightly different now. Mm-hmm. Not many drugs are hitting the market. And even if they are discovered in West and they are available in the West, it takes a while for those products to become available in India for our Indian patients. Yeah. And that is the lag that we are suffering. And the other issue is that many of the drugs which are discovered in Western countries or which are manufactured there are sometimes not useful for the kind of resistance we have in India. So we cannot use them for Indian patients. And that's the reason we see that there is a long gap in getting new antimicrobials to the country. Yeah.
Okay. Now that we are talking about a silent pandemic, AMR, how can we not talk about COVID? And that takes me to my next question. These days, the situation is such that there's a little outbreak and all of us panic. It's like, this is going to be the next COVID pandemic, a pandemic of sorts. So what do you have to say about it, in terms of COVID, what are the key lessons that we have learned, the government has learned, and how are we preparing for the next possible pandemic?
Right. So COVID was a global emergency, and I think India handled it pretty well in whatever way it was. We had glitches, we had many setbacks, yet I think the diagnostic capacity improved in the country a lot. From 50 or 100 labs, VRDL labs overnight, to almost 3,000 labs doing the COVID tests in the entire country. I wouldn't say it was a small feat. It was a big leap for the country.
Yes.
And the other thing was that the communication initially was a problem, because nobody knew about the virus, how the virus is progressing, right, how what the treatment is going to be, how are we going to prevent the transmission. So to start with, I would say the communication was a little challenge, but over a period of time, I think all of us understood, how to prevent, how to protect ourselves. I know many people who did not get COVID at all.
Yeah.
through so many waves. It could be inherent immunity as well, but yet I think there was a lot of communication. And even you would recall when we were young, there was a lot of communication on radio and TV around how to prevent diarrhea, how to do oral rehydration.
Yes.
So I think that will be the key going forward. Government is investing and strengthening the district hospitals. I have myself led the coalition of National Essential Diagnostic Lists, that what are the minimum set of diagnostics which should be available at all centers of healthcare in the government system. Right. And government is actually putting all resources to make those diagnostics available, whether it's a PHC, CHC or a district hospital. So the government is trying to improve the systems, but at the same time, I think there should be more alertness in terms of communities. I mean, one thing is that there's a lot of hype which is created by social media. That is something that we should try to avoid and go by the facts. And that is where I think the role of communication becomes very important. Right. Diagnostics I already talked about. And the other thing which we learnt around COVID was that we had easy, very quick real-time availability of data because of the digitization. Right. And with so much focus on digitization, I think it will go a long way in terms of how quickly we are able to share data between the states to the center, and based on that we can actually launch a more informed kind of a response. So these are few things. Besides that, I think the governance was the biggest issue with COVID, which I think all public health programs can benefit from. Because this program was monitored by the PMO and the Home Minister himself, that made a lot of difference. The funds were made available, the systems were created to implement it better. So all public health programs, I think, can benefit from this kind of focus going forward.
Yes, so talking about COVID, how can we not talk about vaccines? Not focusing on COVID vaccines per se, but I just wanted to understand from you that since you've worked so much in that space, there are a set of anti-vaxxers and then there are a set of people who still trust vaccines. What do you have to say? Should that fear and what all content that we get exposed to on social media that do not get this vaccine, that vaccine, how do you think, what is your message to the people?
I think vaccines is the biggest public health intervention which prevents diseases. So, every medicine or every vaccine has a side effects which are monitored, which are documented very well through clinical trials before a product is put into use by the communities. Yeah. If you would recall, the smallpox vaccine, how did that happen? So I think Edward Jenner was the person who found out that the women who work with cows, they get infected with cowpox and they don't get smallpox. Okay. So he started injecting children in his village with the pustules from the cowpox. And that's how they were, because the virus was similar. So that is how, the smallpox vaccine came around.
That's interesting.
But in today's world, you will not be able to do this. Your ethics committees and all those issues will not let you do this. Yes. So the point I'm trying to make is that the way we run our trials these days, we are actually following the highest level of the safety and the minimum side effects or minimum damage to the trial participants or the persons who are taking that vaccine. There's so much more to it these days. So I think vaccines are the instruments for prevention of disease, and let us continue to use them and protect ourselves. And they are going to be more and more important going forward. I mean, I'm having this flu kind of this thing because I missed my flu vaccine this year. But going forward, as we are going to experience more and more climate change, there will be more adversities that we will be facing. So vaccines will be very important. Vaccines are also important from the AMR perspective. I mean, if we start giving typhoid vaccine now, in our country, you will see so less typhoid infections. But otherwise, recurrent typhoid is so common because the typhoid that we see is so drug resistant.
Right.
So vaccines, I think we should not have a little bit of doubt that they are something else than what they are supposed to do. Vaccines protect.
So with a healthy reminder to get your flu shots, we move on to the next question. So disease X is something that we've started hearing quite often. It's basically an unknown future threat. What is it that you would like to tell our audience about disease X and how worried should we be?
Well, I think with climate change, urbanization, and our cities are ever expanding, and then we are also more adventurous now. People are traveling to hills, to forests, to mountains. We want to see the entire world. And with that, there will be more and more opportunities of getting infected from the wild, maybe. And you cannot scan the environment, you cannot scan the forests. It is humanly impossible. No government will be able to do it.
Yeah.
What we can be more aware is, the first is your own sanitation, hygiene, the basic principles. You are not eating raw meat, you are not indulging in, for example, if you get bitten by a monkey or something take your rabies vaccination at the closest point. So these are just basics of your health. Take the vaccines wherever, take prophylaxis. And also we should have the healthcare system which is more responsive. It recognizes an outbreak quickly and responds to it. That's all about pandemic preparedness. No country, I would say, can be 100% prepared.
Yeah.
This whole process has to be more educational, more about communication, and more about preparedness of the healthcare system to respond to outbreaks better.
Right.
It is not possible to identify every virus and every bacteria that is going to hit us.
Right. So before we end this conversation, how can we not talk about AI? And I would like you to comment on AI, how it is transforming healthcare and helping in the areas that you are working on.
Well, AI is artificial intelligence. And how does artificial intelligence develop? Artificial intelligence trains itself on the data that we provide it.
Yes.
I mean, you have seen it. Today you will see 10 videos on YouTube. Tomorrow it will give you what you like.
Imalgo,
This is what exactly is the essence of AI.
Mm-hmm.
But then India is, I would say, in healthcare, we are at a little bit of a disadvantage.
Mm-hmm.
Reason being, our data systems are not clean, they are not uniform. We don't have that much data that we train our tools on.
Right.
So there are many ambitious startups, there are many innovative, many groups who are working on these innovations. But the challenge is that our data is only a small minuscule of all the data sets that are available from different parts of the world.
Mm-hmm.
And with that, there is a bias in the AI and the ML. So I think there is a huge potential for AI, for example, to prescribe a treatment where doctor cannot be made available. Looking at the TB X-rays, they can identify, is it a TB case or is it a non-TB case, non-TB kind of a nodule in your lungs. Mm-hmm. So similarly for cancers, similarly for predicting outbreaks. Mm-hmm. There is a huge potential, but I think as a country, we have to start working more on the data that is available, which we will use to train more diversity in the data sets. Our data should also be well represented when we, for example, next generation sequencers. Everyone is talking about next generation sequencing these days of pathogens. But the machines which are available are trained on American isolates.
Oh.
With very little representation of the Indian isolates. As a result, the output that you get is not useful to you. Mm-hmm. So that will be the major glitch in using AI in health. But other than that, I think there are data fields which are available in other areas which can be utilized, and that can be a good starting point for the country.
Great. Thank you so much for joining us today. and I hope you all enjoyed the conversation.
Yes, we certainly did, Kalpana. And we ask that you please present Kamini ma'am with the token of our appreciation. All right. And before we get to that, however, I think we're going to present our next set of awards. So, if I could please ask that Kamini and Kalpana please remain on stage with us for our next category of awards in terms of doing the honors. And all of these awards are from your area of specialty, ma'am. So they're of a particular relevance. And we'll start with Service Excellence Award in Vaccines and Prevention. And the winner in this category is Vaxi Flu 4 Zydus. So if we could please invite Mr. Snehit Joshi and Mr. Anand Verma from Zydus Vaccines to receive this honor from Mrs. Walia herself. Congratulations once again, sir. This is Service Excellence Award in Vaccines and Preventions, and it has gone to Vaxi Flu for Zydus. A very deserving honor. Excellent. And from there we move on to our next category, ladies and gentlemen. And the next category is Excellence in Entrance Coaching. All right. And the winner for Excellence in Entrance Coaching, I'll announce in just a moment as our prior winners enjoy their moment on stage. Our winners in Excellence in Entrance Coaching, ladies and gentlemen, is Vision 30. So Vision 30, let's please have you on stage. And under the leadership of Prashant Nath, walks with the principle of enhancing the student success ratio. And with the right mindset and dedication, Prashant Nath believes in the mantra of lifelong learning for students and building that holistic society. Vision 30, ladies and gentlemen, Excellence in Entrance Coaching. And with that, we will move on to our next category, which is Service Excellence in Diagnostics. Again, a very coveted category, a very competitive one. And the winner is Ravi Tomar, Managing Director and Founder of CRL Diagnostics. Ravi, let's have you on stage. Thank you, sir. Yes, because CRL Diagnostics is, of course, the fastest growing pathology lab in the country, and their commitment to quality is reflected with 4 NABL accredited labs and more than 1 million happy customers. Can we have the team on stage from CRL Diagnostics? All right, we'll move on to iconic brand in digestive wellness. And the winner is Mohit Seth, Founder Director, Seth Brothers, Kayam Chuna. Let's have them on stage, please, ladies and gentlemen, to receive the award from Kamini Walia. All right. Okay, well with that, Kalpana, if I could please ask that you give our guest, Kamini Walia, a token of our appreciation, a special memento for being here at the etnow.in Business Conclave and Awards and sharing your insights with us and our broader audience. A memento, please. Thank you once again to both of our lovely ladies. Thank you, and we ask that you please do join us in the audience once again. Thank you so much. And with that,